Welcome to Lion's Eye.
Welcome.
This is one of the main locations where we spend most of our learning and a lot of our training, about 1 year of the 3 years of ophthalmology residency.
Exactly. And for right now, we just want to take you on a little tour. So we have 4 examining rooms, four lanes here. And as you can see, pretty nice state-of-the-art equipment.
And we also have one workup room where we have our wonderful nursing staff take vision and pressure for us, as well as help dilate patients to help the fluid clinic when we get busy.
Vision, pressure, like the fact that we have that done for us is incredibly helpful. You get a ton of support from not only senior residents, but we have attendings here helping to not only make sure these patients have the best care plan, but to teach you about how to deliver the best care plan to them. So it's a nice little symbiosis or a little ecosystem.
It's great, and we do have full representation of all the subspecialties in this clinic as well, so we're able to reach out to whatever type of provider we need. So here's our resident lecture room. It's where we have our daytime lectures as well as some wet labs, suturing courses. Great place to kind of come and talk about patients as well.
Correct, and then we also get lunch catered wherever you are on your rotation. If you're at Lions, you get free lunch. In terms of surgery, let's take a look at this little machine here. I don't think every program has this. It's called an IC machine. You may be familiar with it, but this is essentially like a virtual digital cataract extraction experience. It helps you kind of work on the fundamentals of cataract extraction. All right, next we have our minor procedure room, as well as our laser room. So as you can see, we have PRP here, we have YAG, we have a nice minor procedure microscope here.
Pretty straightforward, but all the equipment that we need to do any of the procedures that we need for anyone in the clinic. We also have an LIO, which is something that not everywhere has access to, that we can work with a retina fellow to use as well.
Coming over this way is a very highly secretive area called our resident room. It's got a great window. This is ophthalmic diagnostic services. This is where any imaging, any ancillary testing we need for our patients, it's done in this area here. It's literally about 10 feet away from where you saw the examining rooms. The imaging includes OCT, we got glaucoma stuff like Humphrey Visual Fields, RNFL, GCC. We even have a B scan if your patient has some giant corneal issue where you can't see in the back, so we can get a nice ultrasound. It's a really comprehensive place.
We also have some of the best staff. We have Denise, who's been here for over 30 years. She's actually an award-winning ophthalmic photographer. She's also a great advocate for us in terms of getting state-of-the-art new equipment, such as OCT angiography, that we have access to. Our other main staff member here is Marina, who was previously an ophthalmologist in Russia, so obviously a great educational experience. We learn a lot from both of them. All right, so here we are at the Pacific Vision Surgery Center.
Welcome.
Soon to be open. This is going to be a great asset to our program. We'll be able to do cataract surgery just 20 feet from clinic. Our clinic is just right down the hall.
Because there are going to be actually 2 ORs. Right now, one's going to be is operational. There will be 2 and eventually 3, and that will all be just an asset to our education and our surgical training. So now we are inside the new surgery center. As you can see, we have about 9 pre-op beds here for patients to relax, get ready for the procedure, and then our first OR is right here. We'll take you quickly inside.
So here we are at one of the 2 ORs that will soon be open, obviously the newest OR in San Francisco.
And welcome to our Pacific Vision Foundation conference room. Here is where all of our grand rounds take place. Generally, it was packed with attendings everywhere, but now we, of course, do it in a socially distanced fashion with a lot of people dialing in. But this is where we present. This is where learning occurs. And actually, you're only seeing 2/3 of the room. It actually opens up more. It's pretty nice. And of course, more free food in the morning. So we look forward to meeting you, Jenna and I, online. And until then, take care and best of luck in the interview process.
When you come to work here, you're gonna see patients from all walks of life and patients from all over the world. They come in with some serious visual issues, and they put their trust in you to help them. You'll find yourself doing some very interesting surgery, seeing some very interesting pathology, stuff that might have an incidence of 1 in 2 million patients. You might see that same diagnosis 2 times in a week or even in a day. There's a lot of interesting infectious diseases, autoimmune conditions, all sorts of retinal pathologies, anterior segment pathologies. It's truly incredible. I myself am astonished every single day by the things that come in through this clinic. Welcome to the ophthalmology clinic at Highland Hospital. Why don't we take a small tour? So this is our waiting room over here, and our resident rooms over here. It's quite spacious. You'll have a full computer with 2 screens to yourself. And then we have multiple exam rooms. As you may notice, the resident's name is on the exam room because you'll be the doctor here and you'll be treated as so. So we'll just take a small tour to one of the exam rooms so you can take a look. And it's just, we're on Epic for our electronic medical record. It's a standard exam room with full, normal equipment that you'll start to learn in. And we're very well stocked. We'll have everything you need. And this is where the magic happens.